Our study is on the outcome of probiotics in acute diarrhea.
I'm Laura.
I'm Irene.
And I'm Ashley. Probiotics are live microorganisms which are thought to be beneficial in numerous ways to the host organism that consumes them. For example, one claim is that probiotics can be used to treat acute watery diarrhea. These microorganisms can be found in many different fermented foods, such as milk and soy-based yogurt, and some dietary supplements. The first scientist to propose using lactic acid bacteria for beneficial purposes was Irene Kim. Sales. Probiotics are sold in many different forms, such as pills, powders, drinks, and foods. Because of the many different ways these items are marketed, they are sold at a wide range of prices, from as low as 80 cents for a yogurt with live probiotic cultures up to $35 for probiotic formulas. Because of these claims about the incredible benefits of probiotics have on the gastrointestinal system, the use of these microorganisms are on the rise. Probiotics work by forming a barrier that can prevent harmful bacteria and viruses from multiplying in the gastrointestinal tract. This barrier enhances the strength of the GI tract and their immune system. Some benefits these protective qualities can have on their hosts include decreasing the prevalence and severity of diarrhea, reducing inflammation of the GI tract, and relieving lactose intolerance. Acute diarrhea occurs when a person passes 3 or more loose stools in a 24-hour period for 3 or more weeks. Usually, acute diarrhea is caused by infectious agents, bacterial toxins, and some drugs, such as antacids and nutritional supplements containing magnesium. Also, many organisms cause diarrhea, such as viruses, bacteria, parasites, and certain fungi.
Prevalence. Worldwide, acute diarrhea constitutes a major cause of morbidity and mortality, especially among the very young, very old, and those people that are sick. Each year, U.S. adults experience 99 million episodes of acute diarrhea or gastroenteritis. There are about 8 million physician visits and more than 250,000 hospital visits each year, which is approximately 1.5% of adult hospitalizations caused by acute diarrhea or gastroenteritis. Diagnosis. Acute diarrheas are usually infectious in origin and resolve before diagnosis can be made. There is presence of blood in the stool and often abdominal pain or dripping. Signs of volume depletion include dry mucous membranes, decreased skin turgor, and treatment for diarrhea includes fluid and electrolyte replacement and dietary modifications. Most people are on the GRAT diet, which includes bananas, rice, applesauce, and toast, and also drug therapy. Good sources of probiotics are often dairy products. These are some examples: yogurt, cheeses, buttermilk, peppers, wheatgrass, etc.
The objective is to compare the efficacy of 5 probiotic preparations recommended to clients in the treatment of acute diarrhea. There were 571 infants studied, including infants that were treated with severe chronic diseases. An oral dosage of 1 billion CFD per dose infants with diabetes with 20 milliliters of water and lactose or calcium, and fed 2 times a day every 3 to 6 hours. This table shows the duration of diarrhea in hours and consistency. This is the diagnosis. This one is the control. This model contains antibodies that are specific in the stool and body. For the shortened duration of diarrhea. This is the table with the median daily stool output from the first day to day 7 of the probiotic administration. The stool size also called Lactobacillus casei strain GG in the treatment of infants with acute watery diarrhea, and it was a randomized, double-blind, placebo-controlled clinical trial. And the study included 179 male infants ages 3 to 36 months old who were suffering from acute watery diarrhea for less than 48 hours. After the infants were rehydrated with the World Health Organization's oral rehydration solution, patients were randomly assigned to receive a milk formula either containing LGG or not containing LGG for 5 days. 89 infants were assigned to receive a formula free of the LGG probiotic, and 90 received the formula which contained 1 billion CFUs per milliliter of LGG. Upon completion of the study, it was found that the infants receiving the LGG formula had a significantly larger stool output than the control group, but the duration of their diarrhea, the rate of their treatment failure, and the proportion of patients with unresolved diarrhea after completing the study was not significantly different from the control group. Again, in the control group, the participants' stool output was significantly less than that of the LGG group, but no other significant differences between the two groups were found. Here you can see that of the 90 patients in the LGG group, only 52 had cessation of diarrhea. This is comparable to the 51 out of 89 control group participants whose diarrhea stopped by the end of the 5-day study. In conclusion, the study found that LGG does not have a positive effect on the clinical course of acute watery diarrhea, though it did not appear to have any negative consequences. It is unknown whether these results can be generalized to other cases of acute watery non-cholera diarrhea.
Okay, study 3 was called the effect of Saccharomyces boulardii in the treatment of acute watery diarrhea in Myanmar children, and it is a randomized controlled study. There are 100 subjects ages 3 months to 10 years with acute watery diarrhea. Diarrhea was defined as passing 3 or more loose stools per day. Diarrhea was considered to have stopped when the child passed less than 3 stools per day or stools with a solid consistency only. Group A was the control group, and they received oral rehydration for 5 days, and Group B received oral rehydration plus S. boulardii 250 milligrams twice a day for 5 days. On day 2 of the study, in the control group, only 15 people of 50 had less than 3 stools per day, which is 30%, and in the S. boulardii group, 27 people of 50 had less than 3 stools per day, which is 54%. On day 3, in the control group, stools had a normal consistency in only 12 of 50 patients, and in the S. boulardii group, stools had a normal consistency in 38 of 50 patients. Results for the study, the control group had a mean duration of diarrhea of 4.68 days, which is a p-value of less than 0.05, and the mean duration of diarrhea was 3.08 days in the S. boulardii group. On day 4, patients were 13 times more likely to pass solid stools after receiving S. boulardii rather than just ORS. After day 5, no patients in the S. boulardii group had liquid stools. As you can see from this chart, the p-values were significant on days 3, 4, and 5 for stool consistency, and there was a 95% confidence interval on days 3, 4, and 5. So the conclusion was that Saccharomyces boulardii shortened the duration of diarrhea and normalized the stool content and frequency.
We decided that our level of evidence is a 3. This is our public health recommendation. Also, 4 ounces of yogurt can be used to decrease effects of acute diarrhea in infants. And additional information is probiotic safety has not been thoroughly studied scientifically. More information is needed on safety for all ages and the immunocompromised. Side effects are mild and digestive, gas or bloating, too much stimulation of the immune system or gene transfer.